Good morning, good evening, students. This class is DNHE-3 and Unit 4, theme in nutrition education. First theme is nutrition during pregnancy and lactation. Second theme is nutrition during infancy and preschool age. Third theme is nutrition during school age, adolescence, adulthood, and old age. And fourth theme is diet as therapy. These themes are included theme in nutrition education. The first theme is we will discuss about nutrition during pregnancy and lactation. Why pregnant women are vulnerable? Pregnancy is the most important period in the lifespan of a woman. When a baby grows inside her body. So this period is very vulnerable period because to grow properly in the womb of the mother, it means the unborn child, which is known as we know about the fetus, because fetus needs a healthy and well nourished mother during this period. And in that period, pregnancy needs to weight gain. Why? The pregnant woman need to weight gain because a mother need to gain weight during the pregnancy to nourishes her growing baby. A baby that whose weight at the time of birth is if less than 2.5 kg is more likely to have both physical and mental problem. So a pregnant woman should gain at least 11 kg weight during this pregnancy period for her baby. If she gain less than 11 kg, the baby's chance for health and survival might be get affected. If, if the mother's weight is overweight, she still needs to gain weight for the baby's health during this period. During the first trimester period, she should expect to gain about 1 to 2 kg. During the last 6 months, she needs to gain about half kg each week. If she has already gained 11 kg after 6 or 7 months of pregnancy, she should continue to gain moderately until delivery of her baby. Hello students, Priyadarshini. Am I audible?
Yes, ma'am.
Okay. What is your full name?
Priyadarshini Kaur,
Priyadarshini Kaur. Which area? Which district?
Madam Bhubaneswar.
Sure. Okay. This is your DNHE-3 class, theme in nutrition and education. Are you in arts and science?
Arts.
Arts. Okay. Odia medium or English medium?
English medium.
Okay. Then can you answer a question?
Yes, ma'am.
Which period? It means how many period is known as pregnancy period?
Mm. 9.
Hmm?
9.
9 months.
Uh, huh.
When a unborn child or a baby grows inside a mother, during this period, 9 months or 280 days is known as pregnancy period. Okay.
Okay, ma'am.
In this period, a woman should gain at least 11 kg during the pregnancy because her baby's nourishes. During the first trimester, uh, the mother gain about 1 to 2 kg weight, and during the last 6 months, she needs to gain about half kg each week. If she has already gained 11 kg after 6 or 7 months of pregnancy, she should continue to gain moderately until delivery. What to eat in during the pregnancy? The pregnant woman needs to eat more food than the normal period, especially energy rich food and bodybuilding food, which is known as protein rich food, and protective food, which are we know about the vitamin rich food and mineral rich food. And also in this pregnancy period, a mother also needs foods which are good sources of iron. Can you explain some foods rich in iron? Anyone? Rich in food iron is like green leafy vegetables, spinach, very much rich in iron, and also ragi. Which factors influences food intake during pregnancy? Which factor? The food intake of a pregnant woman may be affected by the food availability, economical status, acceptabilities, psychological and personal factors affect the pregnant woman's food intake during this period. Any other factors like choices of food and economical factor, environmental factor. For example, economical factor like a woman belong to the low income group will have less choices of food due to economic reasons. Because low economic group peoples or low economic group women cannot afford better diet. Hello, Susmita. And also cultural factors also affect the food intake of during this period. Cultural factors like some beliefs, psychological beliefs, some foods restricted during this period due to cultural beliefs. Basically, Indian families, social practices like women eating leftover foods, both quantity and quality, after everybody eats, are still prevalent nowadays. Some psychological factors also restrict the intake of food. For example, the pregnant mother suffers from nausea and vomiting during the early pregnancy. She cannot eat enough food because in that period, women need much food or inadequate food for her baby. Then, what are the common problems during the pregnancy? Basically, main common problem is morning sickness, constipations, heatburn. These are the some problems which affect the intake of food. How to deal with this type of problem? Morning sickness like nausea and vomiting, we deal with it eating light meal before going to bed at night. A glass of milk and fruits also included in this diet, and also having something soon after getting out of bed, milk and something dry in the morning, dry foods. Frequent feeding with small quantities during this period. Frequent feeding means a small amount of food per day, 5 to 6 meals. Avoid also greasy foods. What do you mean by greasy foods? Can anyone explain? Greasy foods means fatty foods like fast food, except junk food, etc. During the problem heat burn, avoid foods known to cause discomfort. Which food is discomfort for women can avoid during this period. Do not take tea or coffee along with any non-supplement food. Sleeping with chest and head lifted up. Frequent feeding with small amounts, a little bit some difference between some periods, sometimes. It means 2 hour difference between or 3 hour difference between when mother feels hungry, she can eat. How to prevent constipations during this period? In this period, drink plenty fluids, take liquids before eating anything in the morning, and eat fruits and foods with fiber. Exercise also regularly to prevent constipations. In this period, during pregnancy, sometimes some mothers can become severely anemic. What happens? What can we do if a pregnant woman become anemic? How we know about the pregnant woman will anemic? First reason is poor weight gain. If her weight gain is very poor, then we can test about is she suffering from anemic or not. Acha. Uh, how which nutrient deficiency is known as anemia? Can anyone explain?
Iron. It will be
Iron
iron deficiency.
deficiency. Oh, very good. Huh, very good. How can we prevent the iron deficiency? Which food are iron
Uh,
rich food?
Mostly millets are just like ragi millets and spinach and other beetroot.
Spinach.
Mostly these foods are
Yes.
having a lot of iron, rich in iron. Even we will add
Yes.
lemon in dal to absorb the iron availability for better
Right.
absorption.
Very good. To Very good. To utilizing iron, it means citrus fruits, vitamin C, amla, which helps the body to utilize the iron in our body. How we find out if a woman is anemic? What are the symptoms? First of all, clinically we identify it after testing her blood or chemical biochemical test. But how in generally we know about this woman or pregnant woman is suffering anemia? What are the symptoms? Their lips or lower eyelids may be a pale, light pink or white color. Okay. If a pregnant woman suffering anemic, what advice to give them? First advice we will give, visit the doctor clinic at least once a week. At the clinic, the pregnant woman's blood will be checked. After that, we can check the direction of taking iron tablet. What are the direction? What are the some rules and regulation for taking iron tablet? First of all, the pregnant woman should not take the iron tablets with tea or coffee. That is the first and main point to advised give the pregnant woman, because in that time the iron should not prevent in our body or cannot absorb in our body. But we can eat with iron tablet with milk, but not coffee and tea. And sometimes some pregnant women should complain also about iron tablet. They feel upset, and some side effects like like infection, allergy, also taking this period, especially during the pregnancy. So in that period, we can advise iron-rich foods for the pregnant woman. Some iron-rich foods like example chapati, ragi sankati. It means rice and ragi combination, which is known as ragi sankati. Snacks generally seeds and jaggery. Jaggery also a very good source of iron-rich food, and it along with some citrus foods also included to iron, rich in iron. And any preparation made dark green leafy vegetables with germinated pulses, sprouted gums, which is we are known about, we also provide for rich in iron in our diet. Then lactating women. Why are lactating women are vulnerable? Do you know about what which period is the lactating period? Can anyone?
ମ୍ୟାମ୍ ଯେତେବେଳେ ମଦର ମିଲ୍କ ପ୍ରୋଭାଇଡ ହେଇଥାଏ ପିଲାଙ୍କୁ, ଯୋଉ ମା ଦେଇଥାଏ ତାଙ୍କୁ ଲାକ୍ଟେଟିଂ ପିରିୟଡ କୁହାଯାଏ।
Very good. Anyone? Once the pregnant woman deliver a child, the lactation period starts. Because the newborn baby depends only breast milk for its nourishment during this lactation period. So this lactation period is very much vulnerable. If we cannot provide enough food, the lactative women become malnourished. Biswajit, are you in Odia medium or English medium?
ओडिया मैम ओडिया।
Okay, ठीक है। ଯଦି ଆମେ lactating women period ରେ much more vitamins, nutrients, energy and protein rich food ଆମେ provide ନ କରିପାରିବା then lactating women can become malnourished. Why? Because mother's milk is sufficient for newborn baby till 6 months. Mother's milk only because ଆମର ଯୋଉ ଡକ୍ଟର ମାନଙ୍କ ପ୍ରେସ୍କ୍ରାଇବ୍ଡ ଅନୁସାରେ ଆମେ 6 month ପର୍ଯ୍ୟନ୍ତ କେବଳ ଜଣେ ବେବିକୁ ଆମେ ମଦର୍ସ ମିଲ୍କ ଦେଇପାରିବା। ଆଉ ମଦର୍ସ ମିଲ୍କ ଇଜ ଭେରି ମଚ୍ ସୁଇଟେବଲ୍ ଫର୍ ଦ ବେବି ଆଣ୍ଡ ସେଥିରେ ସମସ୍ତ ପ୍ରକାରର ନ୍ୟୁଟ୍ରିଏଣ୍ଟସ୍ ରହିଥାଏ ଯୋଉଟା କି ଯେତିକି ଏମାଉଣ୍ଟରେ ସେ ବେବି ପାଇଁ ନିଡ୍ କରିଥାଏ ବା ଦରକାର ପଡିଥାଏ। ଯଦି ମା inadequate amount ର sufficient nutrients intake ନ କରିବ then ତାର ଫିଡିଂ ବା ମିଲ୍କ ସିକ୍ରେସନ ଠିକ ଭାବରେ ହେବ ନାହିଁ। So the lactating mother need to eat more food, especially energy rich food. Energy in that in your study is very much interesting. Energy rich food are known as go. Can you explain or give some example of energy rich food?
Carbohydrate rich fruits like cereals, legumes.
Cereals, legumes, and all types of sweet foods provide so much energy, and fatty foods also provide much more energy. So these foods are also known as go. And bodybuilding food is protein and minerals. Bodybuilding foods which is help for our body to build our tissues, blood. It also recommend a name grow. And protected foods which are rich in vitamins and minerals, all vegetables and leafy vegetables. In this protective foods also known as glow foods. Now you are very much aware about what are go, grow and glow foods. Okay. Then what influence food intake in lactation? को ଜିନିଷ ଆମର ଇନଫ୍ଲୁଏନ୍ସ କରୁଛି ଫୁଡ କୁ ଇନଟେକ୍ କରିବା ଡ୍ୟୁରିଂ ଲାକ୍ଟେସନ? First of all, this food intake ଯେତେବେଳେ ସେ ଛୁଆକୁ ଆମର ବ୍ରେଷ୍ଟ ଫିଡିଂ ଦିଆଯାଏ ତାର ସାଇଡ ଇଫେକ୍ଟ ହିସାବରେ ଆମେ ଯେମିତି କି ପାଇବା ଡାଇରିଆ, ସମ୍ କଫ and fever also occur during the newborn baby first 6 month period. So these are the multiple factors influence the food intake. This severe these common diseases are also depend upon the mother's dietary habits. And also in that time, these factors also affect the secretion of breast milk, and then the low production of breast milk affects the health of the baby. First of all, ଯଦି mother sufficient amount ର ବା ଠିକ amount ର ଠିକ frequently ଠିକ time ରେ ଠିକ period ରେ nutrients consume କରିବନି ବା food consume କରିବନି, then ସେଟା affect କାହାକୁ କରିବ ନା first affect କରିବ secretion of breast milk, then affect କାହାକୁ କରିବ the health of baby. Why? The next question, why is the breastfeeding is best for a baby? When we see all babies are healthy, to grow healthy and grow well, they must be fed with breast milk. जो छुआ माने फर्स्ट 6 month मदर्स मिल्क कंज्यूम करिथांती से निहाती भाबरे हेल्दी एंड सफिशिएंट न्यूट्रिएंट्स तांको पाखरे एंटीबॉडी बहुत परिमाण रे रही थाए से मानकु इजीली कोनोसे प्रकार रो डिजीज अफेक्ट करे ना. So in that point of view, breast milk contains all the nourishments a healthy baby needs. ସେଇଥିରୁ ଆମେ ଜଣା ପଡେ ଯେ ଗୋଟେ ହେଲ୍ଦି ବେବି ଯାହା ନିଡ୍ସ କରୁଛି ତା ଦେହରେ ଯେତିକି ଆମାଉଣ୍ଟ ର ନ୍ୟୁଟ୍ରିଏଣ୍ଟସ ଦରକାର ପଡୁଛି ସବୁ ଗୁଡିକ ସଫିସିଏଣ୍ଟ ଆମାଉଣ୍ଟ ରେ ଆମର ରହିଥାଏ କୋଉଥିରେ ନା ବ୍ରେଷ୍ଟ ମିଲ୍କ ରେ. What do you mean by breast milk? If any question, then you can answer it is a food produced by the mother especially for baby. And breastfeeding also holds her baby to close. A mother and a baby relationship goes to close during the breastfeeding. A mother gives the baby for warmth and security as well as food. ଖାଦ୍ୟ ଦେବା ସାଥିରେ ସେଫ୍ଟି ଆଣ୍ଡ ସିକ୍ୟୁରିଟି ୱାର୍ମଥ ମଧ୍ୟ ଦେଇଥାନ୍ତେ. ଆଉ ସେଇ ଡ୍ୟୁରିଂ ଦିସ୍ ବ୍ରେଷ୍ଟ ଫିଡିଂ ଟାଇମ୍ ଯୋଉଟା କି ମଦର ଆଣ୍ଡ ବେବିର ରିଲେସନଟିକୁ ବହୁତ କ୍ଲୋଜ କୁ ଆଣିଥାଏ until death ପର୍ଯ୍ୟନ୍ତ. So the breastfeeding is fully protected for the baby. Because ତା ଭିତରେ କୌଣସି ପ୍ରକାର ଇନଫେକ୍ସନ ନଥାଏ, କୌଣସି ପ୍ରକାର ନ୍ୟୁଟ୍ରିଏଣ୍ଟସ ର କମ ଅଧିକ ନଥାଏ, ଇନଡାଇଜେସନ ହବାର ଚାନ୍ସେସ୍ ନଥାଏ, କୌଣସି ପ୍ରକାର ପ୍ରୋବ୍ଲେମ ଅକର ହୁଏନି ड्यूरिंग द ବ୍ରେଷ୍ଟ ଫିଡିଂ. କୌଣସି ପ୍ରକାର ଡିଜିଜ ମଧ୍ୟ ଏଫେକ୍ଟ କରେ ନାହିଁ ବ୍ରେଷ୍ଟ ଫିଡିଂ ମାଧ୍ୟମରେ. So first of all, why breastfeeding is best for the mother? Why? In which reason? को कारण ପାଇଁ breastfeeding ଟା best for mother? Because for mother it is very cheap, it is convenient, it helps mothers to lose weight and put on during pregnancy. It is simple and quick even during travel. Why breastfeeding is best for the child? It contains exactly what the baby needs. It contains no microorganism. It develops a good emotional bond with the mother. It protects the baby from infection. Breast milk jota. So breast milk, why? Best. It protects the baby from infection. It is the natural way that promotes growth of the baby. It is safe, simple and quick. What advice can be given to the mothers on successful breastfeeding? କୋଉ advice ଟା ଆମେ ଦେଇପାରିବା successful breastfeeding ପାଇଁ mother କୁ କିଏ କହିପାରିବ? କୋଉ advice ଟା ଆମେ ଦେଇପାରିବା? First, when the breastfeeding is the natural way for the mother to feed her baby, she must be relaxed and well prepared to feed her baby. Before baby born, the mother is pregnant, her breast is get bigger. She should support them with a feeding, well feeding for her breast. What do you mean by colostrum? Can you explain? A pregnant woman may notice a thin yellowish fluid coming from the nipples. This is called colostrum. After the childbirth within 24 hours, if thin yellowish fluid coming from the nipples, this is called colostrum. This colostrum is most important for the baby. It's just like as antibodies till her lifespan. The colostrum also protect the baby from infection. Colostrum is the baby's first food. That is all the newborn babies needs. How to breastfeed the baby? Lactating mother, how to breastfeed the baby? When the mother is breastfeeding, she should be comfortable. The baby's head and back should be supported with her arm. The nipple and as much as possible of the dark area around it should put into the baby's mouth if the baby suck on the nipple alone. And baby should feed 10 to 15 minutes on each breast. Only one breast, not only one breast. We should feed each breast 10 to 15 minutes. If the baby falls asleep before finishing the feeding, the mother should flick the soles of his or her feet and tap his or her chins so that the baby suck again. After feeding, the mother can burping the child to relieve some gases. What are some of the specific problem during the lactation? There are different situations where the mother needs special attention to maintain her health and the health of the baby. So, which are the situation or which are the problems faced by the mother during this lactation period? First pregnancy is most important because the woman who is pregnant for the first time, they need special counseling. ଫର୍ ହୁମ୍ କାହାଠାରୁ ସେମାନେ ସ୍ପେଶାଲ କାଉନସେଲିଂ ନିଡ୍ କରିଥାନ୍ତି, କିଏ ତାଙ୍କୁ ସ୍ପେଶାଲ କାଉନସେଲିଂ ଦେବାରେ ହେଲ୍ପ କରିଥାନ୍ତି?
ଡକ୍ଟର
ଏକ୍ସପିରିଏନ୍ସଡ ଡକ୍ଟର ତ ଲାଷ୍ଟ, ଓକେ, the experienced mother, health workers, and elder family members can help them or counseling them how to breastfeed successfully and enjoy to it. Sometimes a mother also feel she will not able to breastfeed. In that time, experienced mother and health workers and also family members can help them. Health workers means Anganwadi workers, ASA, these are. Okay. So, and the second common problem is on undernourished mother. When a mother who are poorly nourished produced rich breast milk to feed the baby, they may produce slightly less milk than well-nourished mother, but the milk will be just nourishing and good for the baby. This milk will help to ensure that the baby develops and keeps healthy during the first few months of life. Breast milk द्वारा ही जଣା पड़िଯିବ जे बेबी केते दूर हेल्दी अछि. ଯଦି mother undernourished ରହିଯିବ then ସେ sufficient amount ର nutrients baby ର ଯେତିକି ଆବଶ୍ୟକ ବା need ସେତିକି provide କରିପାରିବ. ଓକେ. So in that time, lactating mother should eat local food she knows well, like formula. And nowadays, what are the local food for baby? Cerelac. Undernourished mothers provide also them, which is not sufficient amount of nutrients, do not provide infection, microorganisms. There are different ways of helping the mother and family to get extra food for lactating mother. What are the different ways helping the mother and family to get extra food? Hmm? First, in home, raising small kitchen garden with vegetable plants and fruit trees. Second, work together. Which type of work? Just discussion about which type of food is sufficient, given sufficient nutrients for mother and her baby, and the baby need which type of food and which type of nutrients, extra food. Okay. And maintaining some dairy animals and poultry on a very small scale. What are the extra food to be taken by the lactating woman? कौन कौन एक्स्ट्रा फूड हे परिबो एई लैक्टेटिंग वुमेन पीरियड रे से माने टेकन करि परिबे. One or two amlas every day. Local preparation are recommended for lactation such as ragi lodus, which are included jaggery ragi. ତା ଭିତରେ ଯୋଉ ingredients ଥାଏ ଜାଗେରୀ ଥାଏ ରାଗି ଥାଏ ସେଇ ଲଡୁକୁ ଆମେ ଦେଇପାରିବା. और पांजरी एवरीडे आमे ताको देई परिबा इस if possible. Then green preparation आमे alternate days रे देई परिबा. Ragi sankati once a day at least. Ragi sankati is a common food practices in the South India. Mothers who have difficult to delivery because long labor or the mother may be tired to feed breast in the right way. Remember the baby suckle her breast after the bath. In that time, breastfeeding should begin with the first half an hour as soon as possible after delivery. Because in that time colostrum also secretion by the mother's breast. Some babies also find to difficult feed from the breast at first because they don't know what are the process, how to feed. This type of babies, those who are teeny at birth, those born before they due to those who have deformed lips or mouth. ସେମାନଙ୍କର ମଧ୍ୟ difficult ହୁଏ when sucking the breast. If the mother suffers any problem related to the breast, she can consult ANM or doctor or health worker immediately and get the appropriate help. Now, nowadays, too little milk is a common reason for lactating mother to give for not breastfeeding or stopping breastfeeding early. What can she do? In fact, the milk of the mother produces usually not enough for baby during the first 6 months of life. She needs to be counseled that she can produce enough milk by the health worker. Also, the mother who thinks that she is not producing enough milk during the first week also needs strong encouragement to feed the baby very often. And also another one is frequent sucking at the breast will help stimulate the flow of milk. It will also help the mother gain confidence and get used to breastfeeding. And the lactating mother always needs community workers or extension workers or the health workers needs during this type of situation to manage all the things. What is the nutrition during infancy? First of all, we know about the pregnant woman, nutrition during the pregnancy period, nutrition during the lactating period, then nutrition during the infancy period. What do you know about complementary feeding? Can anyone explain? What is complementary feeding? Or complementary food, supplementary food also we know about that. Supplementary food or complementary food means in addition with breast milk, other foods. After 6 months, first 6 months, the baby first food is breast milk. After 6 months, baby addition other foods including breast milk, which is known as complementary food or supplementary food. These foods or supplements may be liquid, semi-solid, or solid. When to start? We start this type of foods after 6 months of the baby. And also solid food, when we start solid food, when the baby can eat or swallow solid food. It means 9 months, 8 to 9 months. Okay. At that time, why we provide supplement food or complementary food? Because in that period, baby require more energy, protein, and other nutrients like vitamins, minerals, raw fish, water than breast milk alone for her nourishes. Once weaning has begun, it is important to introduce new foods in the diet as soon as possible after 6 months. So, high energy rich food we can provide when weaning starts. For example, high energy foods. Can you give example? Hmm? High energy rich food. क्या आंसर दियो?
Dry fruits.
Protein, vitamin.
High energy rich foods are staple cereals. First of all, staple cereals are good sources of high energy or good sources of energy. After that, fat, oil, sugar, also good sources of energy. These foods are provide high energy food. Okay. Food rich in which food most probably rich in protein, vitamin A, C, iron, and calcium? Which food? Hmm? Milk. Milk can provide vitamin C, vitamin A, iron. Sufficient enough nutrients are in the milk. Which food are easy to digest after weaning? The first new foods that babies eat should be very soft and easy to digest. For example, idli, pongal, khichdi, etc. These are easy to digest and very soft. Later, when the teeth develop and the digestive system also develop, more solid food should be added gradually. Varieties of food, increasing variety of food in the diet. The young children or infancy children which leads a well-balanced diet as well as stimulate the acceptance of new foods. Because in that time, infancy, the baby's needs includes so much nutrient-rich food and also new foods. New foods like more than cereals and pulses, more than pulses with combination vegetables, cereals, which provide all type of nutrients. Then what points should be kept in mind during the complementary feeding or during taking the complementary food? Which points we can keep in our mind? In most probably combination of food like combination of cereals, pulses, cereals, vegetables, cereals, sugar. Can you give an example of cereal pulses combination food name? Can anyone?
Khichdi.
Khichdi, cereals and pulses combination, and cereals vegetable combination for infants. Uttapam, cereals including pulses, including vegetables. Okay, this type of foods are complementary foods which give more nutrients for the infants. During the period of 12 months, feeding infants, breastfeeding with porridge, with fruit juice, mashed fruit, give idli, pongal, soft chapati. This food also included in our diet. So this type of family's diet should contain food from the three different food groups: energy giving food groups, which are included cereals rich food and fat rich food, bodybuilding foods, protein rich food and minerals, protective vitamins and minerals. Can you give an example of two food combination? Two food combination. Infancy, 1 to 2 year in between infants, 1 to 2 year infants के लिए rice, dal, rice, fish. These are two food combination, cereals and pulses. Then protein rich food and energy rich food. Three food combination: rice, dal, greens, green vegetables, and also rice, ragi, peas. These are combination of three food combination. Four food combinations. What are the four food combination? Can you give an example?
ରାଇସ୍ ଗ୍ରୀନ୍ ଗ୍ରାମ ଡାଲ ତାପରେ ନଟ୍ସ ଆଉ ବାନାନା।
Banana. Okay. So in that time, rice, we can get rice, cereals, carbohydrate, banana, so much sugar and energy, green gram dal, protein, groundnuts, fat and protein. Okay. How many times we can provide a diet or meal? How many meal time period can giving 12 months to 24 months baby? First of all, early morning. In which period? 7 o'clock or 8 o'clock breakfast, 9 o'clock. Then mid morning, 11 o'clock. Then lunch, 1 to 2 p.m. Evening, afternoon. Afternoon, some juice or some fruit juice we can provide. And the evening, some foods including juice, means egg pudding or milk. Then dinner at the time of 7 p.m. to 8 p.m. Then last bedtime, it means only for breast milk, this period. And in that meals, the main meals every day is three main meals. First is breakfast, lunch, and dinner. These are three main meals for the 1 year to 2 year baby. After supplementing food, a mother never stops breastfeeding when the baby is sick. ଜଣେ ଛୁଆ ଯେତେବେଳେ କୌଣସି ପ୍ରକାର ଡିଜିଜ ଏଫେକ୍ଟ କରୁଛି ବା ସିକ୍ ଅଛି ଦୁର୍ବଳ ଅଛି ସେତେବେଳେ ଆମେ ତାକୁ ବ୍ରେଷ୍ଟ ମିଲ୍କ କେବେ ବି ଷ୍ଟପ୍ କରିବା କଥା ନୁହଁ ବିକଜ ବ୍ରେଷ୍ଟ ମିଲ୍କ given sufficient amount of nutrients and it also protect the body different types of infection and illness. How we guide a child who has suffering from diarrhea? First of all, diarrhea means dehydration. So we first give oral ORS means oral rehydration solution. How we give or how we prepare oral rehydration solution. Take a glass of water. After then, you can add 1 or 2 spoons of sugars and also a small pinch of salt and mix according to the taste of the baby. If the baby like sweet, if the baby like salties, if the baby like tears, according to baby's taste. And sometimes the sick child may not want to eat. ବେଳେବେଳେ ସେ ଦେହ ଖରାପ ଥିଲେ ବଡ଼ ଲୋକମାନେ ମଧ୍ୟ adolescents ମାନେ ମଧ୍ୟ ସେମାନେ ଖାଇବାକୁ ଚେଷ୍ଟା କରନ୍ତିନି. And that time mother should try to very hard to give him to eat. So in that time mother can prepare some new food and interesting food, just looking and also nutritious food can give it this time, which are easy to swallow like thick porridge or bread soaked in milk. Some other tastes also can add in that food, and also mother can give some yellow orange vegetables cooked and fruit like papaya, mango, and plenty of fruits. Sick children need plenty of tender, loving care. And that time ସେମାନଙ୍କୁ ବହୁତ ସାରା care ଦରକାର, love ଦରକାର, affection ଦରକାର. Why is the preschool age? Which period is known as preschool age? Can anyone tell? Which period? Which year?
3 to 5 years.
3 to 5 year is known as preschool age. In that, the preschool age period is called critical period. In this period, we can development of food habits. In that period, ଆମେ ତାଙ୍କର food habits କୁ develop କରିବା ଦରକାର because preschool child very active, like is running, very much running, jumping, and climbing. So in that period, active movements increase in preschoolers. They start imitating to adults. So parents need to be careful during this period. In that period, multiple factors like social factor, cultural factor, availability, personal factor, economical factor, mother's nutritional knowledge play a crucial role for in forming lifetime food habits of the children. ଏ ସମୟରେ ଛୋଟ ଛୁଆ ମାନଙ୍କର ଫୁଡ ହାବିଟ୍ସ କୁ ଫର୍ମିଂ କରିବା ପାଇଁ ବହୁତ ସାରା ଫ୍ୟାକ୍ଟର ଆଫେକ୍ଟ କରିଥାଏ ଯୋଉଟା କି ମଦର୍ସଙ୍କର ରୋଲ ପ୍ଲେ କରିବା ବହୁତ କ୍ରିଟିକାଲ ହେଇଯାଇଥାଏ. So therefore, preschool age is considered a critical period in development of food habits. What are the good nutrition in preschoolers? कौन कौन good nutrition रहुची we can provide preschool children. Good nutrition means in that time we can provide sufficient amount of energy rich food, bodybuilding food and protective food. What are the signs of good nutrition? गोटे पिलाटे sufficient good nutrition पाइछ बोले आमे केम जानिबा. What are the signs? These signs are posture is good, skin is clean and smooth and soft, eyes are bright and clear, tongue is pink, uncoated and moist, fingernails are pink, muscles are formed and well developed, breath is fresh. These are the good signs for good nutrition for a baby or preschool children. When the children do not get enough food, they become malnourished. This malnourished may be undernutrition and overnutrition. The infant's weight should increases to 3 times the birth weight at once a year of the age. If the baby's weight is in the birth at the time of birth 4 kg, at the 1 year it will be how many? 12 kg. Okay. The growth of young children can be monitored at Anganwadi centers, which are established all over the country. At Anganwadi, workers or mothers can weight their children and can get the weights plotted how the growth rate become the child. It means they can monitor the growth chart for the children. Most of the children's receiving 4 to 5 meals per day, but it is not sufficient for him. So they may falling sick quite often, diarrhea, measles, and other infections. And also they suffer some nutritional problem which affect the child. What are the most common nutritional problem? Can you explain? During this preschool period, First of all, protein energy malnutrition. Which disease is known as protein energy malnutrition?
Marasmus.
Marasmus and Kwashiorkor. And iron deficiency is known as anemia. Vitamin A deficiency is xerophthalmia. The first symptoms of the protein energy malnutrition is growth failure. The child's thinner or shorter than the normal weight and growth. And in this, growth failure can be seen most clearly on the child's growth chart. We can see about by the help of community worker or Anganwadi worker. The severe form of protein energy malnutrition is marasmus and kwashiorkor. Acha. In which period occurs marasmus? Ko year re basically marasmus होता है. ठीक है. During weaning period. Weaning period means many childs in between the 6 to 14 months. Okay. Because in that period they need or the babies need more food in addition to breast milk. What are the symptoms of marasmus? What are the symptoms of marasmus? First symptoms is children have stopped growing and their skin is very much thin with no fat. All skins and bones are very much underweight, just like an old person's face. Marasmus children are always feeling hungry. And also he or she have pot belly. Then kwashiorkor. Kwashiorkor starts in which age?
18 to 48 months.
18 to 48 months. Kwashiorkor starts in between the age of 18 to 48 months. It is a serious sickness, especially when there are the added complications of infection. What are the symptoms of kwashiorkor? The children have stopped. The main symptoms is growing stopped. Second is they show body swelling. It means edema. And especially on the legs and feet and sometimes on the face are like just like as moon face. Thin upper arms and have thin reddish hair. Soft and flabby muscles. And many more times they don't want to eat. Miserable looking, just looking so fully moon face, gravy face, this type. And so always they are unhappy. the children are become malnourished during the preschool period? What are the reasons? First reason is inadequate feeding or insufficient nutrients. Then second things, during the reason of the large family size and also birth order result in adequate food distribution. This also repeated pregnancy also result in poor and maternal health, which is leading to inadequate secretion of mother's feeding breast milk, inadequate secretion of breast milk, and babies who are born small, less than 2 kg, improper weaning practices and weaning foods, and six, differentiation in feeding results in female child sufferings malnourished, repeated attacks of infection, repeated fever, repeated illness during this period also become malnourished, the child become malnourished, improper care, improper food choices, also a reason for become the children is malnourished. Those children who have serious malnutrition and often associated with repeated infectious disease, they need special care by health workers and community workers. After that, they need to be referred to a doctor. For example, a child suffering marasmus, after that they suffering kwashiorkor. So in this reason they do not eat. We can press the first, we can concern about health worker, then we can concern about doctor. How can we prevent malnutrition? How we prevent malnourished? First of all, the mother's breastfeeding the child as long as possible. ଯେତେ ଦିନ ପର୍ଯ୍ୟନ୍ତ ଆମେ ଚେଷ୍ଟା କରିବା ସେ ଚାଇଲ୍ଡ ବା ସେ ବେବି କାହାଠୁ ଫିଡିଂ କରିବ ବ୍ରେଷ୍ଟ ମିଲ୍କ ମଦରଙ୍କ ଠାରୁ. ଓକେ, after 6 months onwards the child give mixed diet, in mixed diet which included cereals, pulses, flesh foods, vegetables. All different food groups are included in her diet, which can help malnourished child to better and quickly and healthy lifestyle. And also we can add varieties of foods including different food groups, which helps to balance diet of the children. How we know about a child suffering from anemia? आमे केमती जानिबा जे से पिलाटे anemia suffer करूछ. What do you mean by anemia? Iron deficiency disease is known as anemia. But anemia is a condition When the blood has too few red blood cells or too little of the red pigment hemoglobin. Are you know about hemoglobin? Hemoglobin level amara blood re rahichi. Hemoglobin always carries oxygen to all parts of the body for their normal function through the blood. Blood रे amara hemoglobin थाए जोटा कि ऑक्सी hemoglobin ने रूपांतरित है कि different parts को body रो different parts को hemoglobin oxygen को carry करी थाए. So what are the symptoms? आमे से symptoms रो ही जानी परिबा जे पिलाटी suffering करिछि anemia. First is pale and transparent skin. Second is child may be less active than normal period. Child may have different types of suffering, different types of infection. And inside the lips, gums, and lower eyelids are light pink and whitish instead of bright pink. Instead of bright pink. Eyes look pale and dull. Swollen face and feet. These are the symptoms to find out a anemic children. Rapid heartbeat. Feel like eating more dark chalk, etc. Shortness of breath. What are the causes? A child becomes suffering from anemia. Inadequate intake of iron-rich food. It means when the child, after the 6 month, the child eating with breast milk supplementary food ba amara complementary food को eat करूची which contain very little iron. This type of foods contain very little iron so that the child become anemia. If the foods rich in iron such as green, if the foods rich in iron such as greens are not given to a young child regularly, he may get anemia. The body cannot make enough red blood if it does not have enough iron. Those child who growing very fast, they need more iron to make blood. Maternal malnutrition also a common causes for anemia. If the mother was anemic during pregnancy, the baby may start life with too small store of iron. How to know about a baby maybe or a child may be premature? When the child was born before the full term, it means 9 months to 80 days before the child birth is known as premature birth. The children who are born early or a premature baby, born to anemic mother, feed too long only on milk, long time only on milk, infested with parasites such as hookworm or tapeworm, not eating mixed diet which contains iron-rich foods, they may become anemic. Those childs may become anemic. How to treating a child with anemia? who suffer from anemia, how we treat? First of all, we provide or we give plenty of iron-rich foods like ragi in cereals, pulses, millets, and in green leafy vegetables, spinach. We can provide in her diet. Give an iron tablet or iron tonic. We can provide concerned about with the doctor. Give iron tonic after meal so that it does not upset the child. After meal, we can provide iron tablet or iron tonic. How can we prevent anemia in young children? Basically, during the adolescence period or children period, some children suffering from anemia. How we prevent? First of all, during the pregnant woman, when the baby is in the fetus or mother's womb, in that period, a pregnant woman should eat different kind of foods, especially those with plenty of greens, liver, jaggery, whole grain cereals, and also pulses. And also, pregnant women need iron tablets for better availability of iron in the body compared to the dietary iron. And also concerned about the premature birth of the baby. The pregnant woman so much aware about premature baby. Because nowadays the 80% babies, premature babies are suffering from anemia. After birth or after about 6 months, babies should have a mixed diet which contains good food, means rich in iron. Babies should not be fed with tea because it slows down the use of iron by the body. बेबी को केबे भी छोट समय रे जो माने anemia सफर करछंती तांको टी दबानी because से iron absorption टिकु आम बॉडी रे which is calcium or vitamin C जहा को हेल्प करंती iron को absorption करिबारे से iron absorption को स्लो करिबारे हेल्प करि थाए बट टीटा इफेक्ट करि थाए iron absorption स्लो हे थाए. Fruit juice, which tastes sour like orange grapes, helps the body use of iron better form of food. This would also, we can provide different meals which contain plenty of iron. Vitamins and minerals are essential for keeping good health. Vitamins and minerals are essential for keeping good health. Vitamin A, particularly vitamin A, is essential for normal health and survival. Vitamin A also necessary for normal skin as well as vision. Because when we suffer vitamin A deficiency, night blindness, xerophthalmia can occur. So mild deficiency of vitamin A in a child for a long period makes the child more prone to infection and thus infection disease occur again and again. When the vitamin A deficiency is severe, the eyesight will get affected. Initially, inability to see in dim light may occur, which is we also known as night blindness. Some children take a long time to adjust their sight when they suddenly come into the dark room. They cannot adjust their vision. It also a severe deficiency cause of vitamin A. After the severe, if the severe vitamin A deficiency can develop, it may causes finally the blindness of the person. And sometimes vitamin A deficiency is a common problem or generally seen in children, particularly under the age of 5 years of the children. It does not appear to be serious in adults, but it may be particularly serious about the children those children who are under the age of 5 years. Why the children suffering from vitamin A deficiency? What's the reason? The children are not fed with colostrum because colostrum are rich in vitamin A and other substances and nutrients are also included in this food which give resistance to infection or protect our body. Artificially feeding children are more likely to develop vitamin A deficiency. जोमाने कि ब्रेस्ट फीडिंग करि नथांती बेसी समाने आर्टिफिशियल फीडिंग करि थांती those children are more like to suffering vitamin A deficiency disease. If the pregnant woman's diet is deficient in vitamin A, the newborn baby will have less vitamin A stores. If the pregnant woman suffering vitamin A deficiency, the child become or the newborn baby will have less vitamin A, so that they also suffering from vitamin A deficiency disease. How to avoid these consequences of vitamin A deficiency? It is not difficult. It is not difficult to avoid blindness due to vitamin A deficiency. Vitamin A has a special features which we can provide large amounts. The excess quantity of vitamin A rich food if we can provide excess quantity of vitamin A rich food, then we will avoid these dangerous consequences. How we improve the vitamin A status? First of all, the newborn should be put to the breast soon after birth so that the infant can get enough vitamin A rich or vitamin A. After weaning, supplementary food should contain rich source of vitamin A. Vitamin A rich source of food like milk, egg yolk, greens, carrot, papaya, etc. And also, pregnant and lactating mothers should consume plenty of vitamin A rich food to improve the vitamin A stores of the child. during the pregnancy period, during the lactation period. We can encourage pregnant and lactating mother the child to consume plenty of foods rich in vitamin A whenever possible to help the child get enough sufficient vitamin A to prevent the vitamin A deficiency disease. Vitamin A rich foods are it is essential to include dark, dark green leafy vegetables, milk, fish, egg, meat, seasonal fruits, seasonal vegetables, cereals like which are rich in vitamin A deficient A. Vitamin A rich foods are ragi, rice, wheat, pulses. Oils are also fat soluble vitamins included in oils. Next is nutrition during the school age period, adolescent period, adulthood, and old age. Which period or which year is known as school going period? Which period? କୋଉ year ରୁ କୋଉ year ଆମେ କହିପାରିବା school going period?
6 to 12.
6 to 12. Before adolescent period is known as childhood and also school going period. School age children are still growing, although not fast as their younger brothers and younger sisters. Their growth rate was very widely between different sexes. Boys' growth rate is different than girls' growth rate is different, and they are usually distance. In this period, nutritional requirement or nutrition plays most important role in school going children. Breakfast is particularly breakfast. Breakfast is most important for school child. It breaks the fast, so that it also known as breakfast. Because after sleeping hour, which large amount food they eat is known as breakfast. So the school child's breakfast prepare the child for the attention in the learning hour at school. ताको attention ने रखिकी तार learning hour को तार खाइबार स्टाइल को तार likes and dislike food को attention ने देकी हमको कौन करिया को पड़े ना तांकर breakfast preparation करिया को पड़े. Healthy diet दबाको पड़े because we break the fast. In this period, children do not eat properly. School going children, those who are go to first 6-year children or 7-year children, they do not eat properly. They will not be healthy. they will not grow and develop as they should. ତାଙ୍କର ଯେତିକି ଦରକାର ସେମାନେ ସେତିକି develop କରନ୍ତିନି, ସେତିକି ସେମାନେ grow up ହେଇପାରନ୍ତିନି. So the school children who not get enough foods and right kind of foods cannot pay attention in the school. These hungry children also suffering from malnourished. They may fall sick quite often due to these reasons. This may be early symptoms is iron deficiency, anemia in school children because they don't get enough food. They don't get enough right kind of foods, cannot pay attention about their diet or food habit or food choices. They feel hungry easily. They cannot understand. They feel hungry. These regions they suffer many times illness or fall sick, and also they suffer different degrees of anemia. When we prepare the school children's diet or meal planning, we should attention that the combination of foods from three food groups, different food groups को आमे combine करिके सेमानंकर meal planning बा meal preparation करिबा. Every day, at least 3 meals containing enough foods from all the food groups. We can pay attention this type of foods, which will help the children to develop properly and stay healthy, to learn well. जोटा कि आमे जदि all types of food groups को include करेबा in her daily diet, जोटा कि तांकर ग्रोथ एंड डेवलप को प्रॉपर्ली करिवो, तांको हेल्दी रखिबारे सहाय्य करिवो, and they should learn very well. Okay, and this type of diet should also contain foods rich in iron, rich in energy, rich in protein, so plenty of greens, green vegetables which are needs vitamins and minerals. Okay, so that so a good breakfast is very important for school children. If the school child does not have breakfast before leaving home, he will not able to pay attention to their lessons in the classroom. Acha, can you explain one example for breakfast school going children? Hmm? Can we give, for example, idli, groundnut chutney, seasonal fruits, and milk? We can give as the breakfast for school going children. We also these are the breakfast. After the breakfast, those children who are prepared for lunch, how we make the lunch? Because when we prepare lunch, variety of model of lunch can brought by the altering the kind of dals, vegetable, fruits, etc. we can add in her diet. Generally, children enjoy lunch because they eat along with their friends. Sometimes some children enjoy their lunch. They also start sharing with each other during the school age period. This may help the children to get introduced to new foods. If they share their lunch or tiffin box to each other, they get introduced to new foods in her diet. Foods like snacks, we can provide cereals, pulses, oil, fruit juices, ground nuts for nourishing their nutrients. And those school going children are also very interesting to eat snacks. Sometimes we also provide some snacks. They can also carry it along with their packed lunch bags, which they interest. After eating your lunch bags, you can eat these snacks. They also eat lunch. This helps. This snacks also helps children to get interested in the lunch box. Dinner may be the one meal which the child can eat without rushing. Mothers should encourage the child to eat dinner. They should pay full attention to eating, so there should be no distraction around. Like other meals, dinner should be based on good nourishment mixtures, food from the three different food groups. Food groups are how many types? Can you explain? How many types are food groups? First of all, cereal and millets. Second, pulses. Third, vegetables. Fourth, green leafy vegetables. Fifth, milk and milk product, meat, fish, egg. These are 5 basic food groups. So, according to these food groups, we can provide or added all the food groups to prepare our meal in the per day or a day. Which nutritional problems are common in school-going children? Common nutritional problems observed in school children are anemia, iron deficiency, which is the iron deficiency problem are known as anemia, riboflavin deficiency, sometimes vitamin C deficiency also observed. Vitamin C deficiency also seen among school-going children. The common symptoms are bleeding gums, which bleed profusely untouched. In chronic cases, the teeth may become the loose and fall out due to vitamin C deficiency. It might generally result when the diet is lacking mostly. If the diet is lack of fresh fruits and vegetables, it may occur vitamin C deficiency. People who eat salads need not be worried about vitamin D. Those people who are eat salads regularly, they need not to worried about the vitamin C deficiency. ତାଙ୍କର କେବେ ବି vitamin C deficiency ହବ ନାହିଁ. Those who do not eat vegetables or fruits or due to various reasons usually have diets deficient in vitamin C. If we can for prevent vitamin C deficiency, we can manage or provide amla, guava in the diet of the children because amla, guava are rich in vitamin C. Germinated whole cereals and pulses can also rich in vitamin C foods. These are also we can include in the school going children's diet. Can anybody have any doubt?
No, ma'am.
Then next class we discuss about the growth pattern of adolescent. Okay.
Okay, ma'am.
Thank you.
Thank you, ma'am.
Goodbye.